this little video. This is Alan from Acupuncture Gold Coast, and just take a couple of minutes of your valuable time just to talk about morning sickness, one of the most common conditions experienced by women in the first trimester of pregnancy. This can often actually be a more prevalent condition in the second and third pregnancies. Sometimes, well, it's quite common for women in their first pregnancy to get through without the morning sickness. Morning sickness is a diabolical condition. I've seen the most extreme cases where the individual, the mother-to-be, has been absolutely waylaid, paralysed with nausea, headaches, vomiting, just complete and utter lethargy as a result of the heaviness that's overcome them with the onset of morning sickness. From an Oriental medical perspective, morning sickness, depending on the constitution of the individual, is very much a situation where the energy that would normally go to maintain harmony in the stomach and intestines becomes a little bit disorientated as a result of that energy being consumed with growing the baby. So from a very elementary perspective, that is the reason why this phenomenon occurs, this condition occurs in the first trimester of pregnancy, because there is a lot of effort and energy being consumed by the mother in the growing of the baby. Morning sickness can vary from just feeling off colour and not particularly well, lethargic, apathetic, tired, with heavy head, sinusy type headache, to the extreme that I just mentioned, where the person can be pretty well waylaid and bedridden as a result of the condition. Morning sickness is a misnomer, really. In my experience, in my clinical experience, and I've treated hundreds of women who've been suffering from the condition, morning sickness can occur at any time of the day, and in severe situations it can even occur at night. So whilst it's more prominent in many individuals in the morning, there is no rule that says the mother-to-be will only be sick in the morning. With the very gentle traditional acupuncture approach that we use here, we would call Japanese acupuncture. We use a combination of acupuncture and moxibustion, very gentle, no discomfort whatsoever, to help resolve this condition. It's proven to be very, very successful in the years that I've been practicing. I think I worked with my first patient with morning sickness probably in the very early 1990s. So I have been working a lot in the last few years with people suffering from this condition. And one of the most prominent examples I can bring to bear was a midwife who was trying to work, and she was pregnant, and she then suffered from horrific morning sickness. So it was an ambivalent situation for her, where she couldn't actually do her work as a midwife because she was suffering from morning sickness. It took perhaps 2 or 3 weeks. However, we were able, or I was able to help her to a situation where she was able then to carry on a relatively normal life as we quelled the deleterious symptoms of morning sickness. This is Alan from Acupuncture Gold Coast saying you're welcome to give me a call anytime about this condition. Thank you.